Hey everyone! Are you prepping for the NCLEX and feeling a bit overwhelmed by infection control? Don't worry, I've got you covered. In this video, we're diving into the essentials of infection control and safety to help you ace your NCLEX. Let's get started. First up, let's talk about standard precautions and transmission-based precautions. These are the foundation of infection prevention in healthcare settings. So, what are standard precautions? Simply put, they include practices like hand hygiene, the use of personal protective equipment or PPE, and proper handling of patient care equipment. Think of it as your first line of defense. Now, let's break down transmission-based precautions. These are extra steps you take when dealing with specific types of germs. We have three categories: airborne, droplet, and contact precautions. For airborne precautions, you'll need specialized rooms with negative pressure and N95 respirators. Droplet precautions, on the other hand, require surgical masks and maybe even face shields. And for contact precautions, you'll use gloves and gowns. These measures ensure that you, your patients, and your colleagues stay safe. Next, let's touch on some common infectious diseases you'll need to know for the NCLEX. Tuberculosis, influenza, MRSA, and COVID-19 are big ones. Each has its own mode of transmission and specific isolation protocols. For instance, tuberculosis requires airborne precautions, while influenza and COVID-19 both need droplet precautions. Understanding these diseases and their protocols is crucial. For example, TB patients should be in negative pressure rooms, and healthcare workers should wear N95 masks. For COVID-19, a surgical mask, gown, and gloves are often recommended. Now, let's move on to isolation protocols. This involves setting up the patient's room correctly, ensuring proper patient placement, and controlling the environment to prevent the spread of infectious agents. Essentially, isolation precautions help contain the infection and protect everyone in the healthcare setting. Finally, let's talk about patient and staff safety measures. Vaccination is a key part of this. It's not just about protecting yourself, but also your patients. For example, getting the flu vaccine reduces the risk of spreading influenza in healthcare settings. Environmental cleaning is also crucial. Regular cleaning and disinfection of patient rooms, medical equipment, and high-touch surfaces can significantly reduce the risk of healthcare-associated infections, or HAIs. And what about outbreak management? This involves strategies like surveillance, contact tracing, and communication protocols to manage infectious disease outbreaks effectively. It's all about being prepared and acting swiftly to control the spread. Alright, let's recap. We've covered the essentials of standard precautions, transmission-based precautions, common infectious diseases, isolation protocols, and patient and staff safety measures. Understanding these concepts is key to both your NCLEX success and your future nursing career. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more NCLEX tips and nursing education content. Stay safe, and good luck with your NCLEX prep. Subscribe for more NCLEX tips, nursing education content, and infection control updates. #NCLEX infection control, #nursing student, #infection control, #patient safety, #NCLEX prep, #nurse life, #healthcare education,